Now the tooth that's in the canine position has some internal resorption, is a little bit loose and a very short root, very irregular root. So we're going to choose to take this out. Now we could have placed the implants at the same time, but we would probably have been sure to not be able to generate a papilla between these two teeth. So we chose to do a staged implant placement procedure and then do a papilla pulling technique to try to generate a papilla and come back and then place the canine to get rid of this bad root and bad tooth. So once I pull the tooth, I check the buccal plate is actually quite good. So we're going to go in with a precision drill first. The reason why we use this drill is because we can go into the lingual wall. We can go in and mark this about 1/3 up the lingual wall and go in and actually prepare this lingual wall so that we can place the implant in a very ideal position. We don't want to be where the tooth used to be. We want to be lingualized to this area. Our next drill we use in the extension is the 2mm twist drill. We want to be 3mm for the head of the implant above the free gingival margin. So we have to drill a little bit deeper than normal, and I actually like to drill a little bit deeper than I would anyway. Then I'm going to take a 2.4, 2.8mm drill and drill 1/3 of the distance that I just drilled. After this, I'm going to take a 3.2mm drill and make a little hole in just the lingual wall, so I'll be able to start the end of the implant, because the implant is actually 3.2mm on the tip of the implant. So if we look here, this tip of this implant is 3.2, and it's going to be able to go through that access on the lingual aspect of the socket. So essentially, since the implant is 13mm long, we had to drill at least 16mm from the free gingival margin to make this long enough for this implant to go in. We start to feel this implant grabbing, and it's a nice feeling when this implant goes in, because this implant can torque up to 70 Newton centimeters, which is recommended by the manufacturer. We need to have at least 35 newtons in order to temporize this and in order to kind of make a nice papilla. So we're going to check this now, and we can see here that there's 45 newtons right there. So I'm actually getting about 50 to 55 newtons of torque here, which is fantastic, and this is what we need for immediate placement and temporization. When you have an immediate placement, you're going to need to clean out some of the bone around the top of the implant in order to have this abutment seat. So we use a bone mill just to clean a little bit above the implant platform, and then we're actually going to have to clean a little bit on the lingual, because if you place the implant at the level that you need to place it, which is 3mm above the free gingival margin, then some of the lingual bone is going to hold up your abutment, especially if you don't clear this out. It's going to kind of ruin your day later on when you go to try to put the final abutment in there. So we put in a cover screw, which is going to completely cover the top of the implant, and then take a drill and kind of clean out the lingual. Very soon there's going to be drills that will prepare this area and make it a lot easier. Now once we get this cleaned out in this area, the implant's not going to be affected because the cover screw has actually been protecting the whole top of the platform shift and the implant itself. Now I like to use a titanium cylinder to make my temporaries. If you want to see this, you can see this on YouTube under some of my other videos. You can find these at www.drscottmclean.com. But essentially what I like to do is to make a bullet on the cylinder with some flowable resin and try to create this so that it's not going to be going with flowable resin down into the socket area, which is close to the brand new implant. So we like here this, go back to the mouth, place it in, and then once we place it, we want to make sure that this is seated properly. So we take an x-ray to confirm the seating, and we can see that it's fully seated here according to the standards outlined in the guidelines that for placing this implant. So then I'll take some Luxaflow here, start to build the contour, build the contacts, take this out, and then finish shaping it out of the mouth, but pick up contacts and pick up the facial profile first. We'll have some of the basic shape of the temporary. Once you take it out, you can start to fill it in, fill the contour in, because you can easily do this with some flowable resin and put it on a replica to get the shape to what you want to have an ideal shape. Once the implant is placed in this lingual version, it's actually going to have a jump gap in front. So we'll use an allograft to kind of fill this jump gap. So we'll use some saline, inject the saline by pumping it into the allograft. This will allow us to be able to carry a wet slurry of bone material so that we can put that into the jump gap. So I usually like to put on a 5mm high healing abutment in order to keep the bone out of the implant. Then I'll inject the bone into this jump gap and kind of push it up inside to make sure that it reaches up to the top of where the end of the implant is, or at least where the jump gap is. So I can just kind of push it up inside, be very gentle, but leaving the healing abutment on will allow you to get back to the implant when you want to place the temporary. So I actually use a bridge type of healing abutment here to keep the bone completely off the top of the implant, because the bridge healing abutment will go to the outside of the implant, which makes the bone kind of pass. So this is a good way to get the bone grafting material up in the jump gap without getting it all clogged in the implant. Once the bone grafting is completed, we can take the healing abutment off. The bone's going to stay nicely where you've placed it because of the slurry is starting to harden it a little bit. Then we're going to take our immediate temporary that we fabricated out of the resin with the cylinder and place that back into the implant and start to tighten this down. If we show the before the papilla was made, you can see it's quite a difference in terms of how the shape of the papilla has occurred with doing some pulling techniques and being creative. Now we're going to take a retraction cord, place it into the cylinder. We have this out of occlusion. We don't want any occlusion on this. We'll take a little bit of ferment, make a little ice cream cone shape, stuff that in, light cure it, and then we're off to be completed. We'll leave this for a minimum of 3 months, then come back and we'll remove the temporary. This temporary has not been in occlusion over this time. We have it into a non-functional loading situation, so only food would hit it. So once we take the temporary off, look at this tissue. It's pretty amazing. The tissue that we've created is going to be staying. So you can see here, it's just amazing how this procedure will work. And so then we do a custom impression coping by doing some techniques that we can't go over right now, but you can see here this customized impression coping allows us to hold the papilla again. Then we'll fabricate this beautiful zirconia screw-retained crown using the Nobel Procera CAD-CAM technology. And this allows us to make a very precise fitting shape that's actually, they can duplicate the shape on the scanning. So my technician will do this by scanning the actual shape of the impression coping that we'd made in 3D. And then by creating a nice color and contour, we're able to make this look really beautiful for the patient.
Natural, I can't tell.
I usually recommend that once the crown is in place, that we take an x-ray to confirm the seating, and then we can tighten it down to the manufacturer's recommended 35 Newton centimeters, which is showing right here. We're just taking this down. There's 35 right there. So that's perfect. Now the patient can have a look, and the technician can get in there and have a look too. He's pretty excited about his new crown that he's manufactured for me, and he's done a beautiful job here. So if we look at the patient, we can see it looks fantastic, and she's really excited about this.